All right, let's talk about those moments in nursing where every single second counts, in acute and critical care. Well, today we're diving into a resource that's all about mastering those moments. It's the second edition of Transforming Nursing Practice, and honestly, it's a guide for any of us who are right there at the bedside when things take a turn.
So here's the question. A patient's condition is changing, and fast. Are you ready? And look, that's not just some abstract idea, right? That's the real, everyday life of a nurse. We all know that feeling, that drop in your stomach when you see the signs. A patient is starting to shift. Well, that's exactly what this guide is for. It's all about how you can turn that initial panic into a solid, confident plan of action.
Okay, so here's our game plan. We're going to start with the deteriorating patient problem. Then look at the guide itself. From there, we'll dive into mastering core skills, tackling specific illnesses, checking out the new tools, and finally, wrap it all up with building that clinical confidence. It's a journey from the problem to the solution to you feeling ready for anything. All right, Section 1, the deteriorating patient problem. So let's really get into why rapid assessment has become such a huge focus in healthcare. It's a big deal, and for good reason. And look, this isn't just someone's opinion. The National Patient Safety Agency itself puts a strong emphasis on the importance of undertaking a rapid assessment and management for any patient showing signs of deterioration. That tells you everything, doesn't it? This isn't just a nice-to-have skill. It's an absolute must for patient safety. And get this has been a major focus for over 10 years. Think about that. For more than a decade, healthcare systems have been trying to get better at assessing deteriorating patients. That just shows you how serious and persistent this problem really is and why we absolutely need solid, structured ways to handle it. Okay, so we've established the problem. Now, for Section 2, your guide to action. This is where we start talking about the solution. We're going to look at this textbook not just as a book, but as the tool you need to tackle this challenge head on. So what's the core purpose here? Well, it's really about two key things: building your clinical skills and, just as importantly, building your self-confidence. It's not just about knowing what to do, but having the guts and the assurance to actually do it when you're faced with an unstable or critically ill patient. And that goes for any setting, whether you're in a hospital or out in the community. And this isn't just some random collection of advice. The whole book is directly aligned with the official NMC standards. That's the Nursing and Midwifery Council. So everything you learn here is mapped to the key skills and competencies you're required to have as a professional. It's designed to make sure you're not just meeting the standards, but you're actually excelling. Okay, on to Section 3, mastering the core skills. This is where we get into the foundational frameworks for assessment. They say that in a crisis, you don't rise to the occasion, you fall back on your training. Well, this is that training. And here it is, the core methodology. It's a simple 5-step framework for rapid response. Look, feel, measure, monitor, and respond. How beautifully simple is that? It's like a mental checklist you can just click through in your head, bringing some calm and order to a chaotic situation. Look, feel, measure, monitor, respond. Simple, but incredibly powerful. Now, what's really important to know is that this framework doesn't throw out what you've already learned. It's designed to be used with the ABCDE assessment. Airway, breathing, circulation, disability, exposure. Think of it as another layer on top of that foundation, a way to enhance the systematic thinking we all learned from the Resuscitation Council guidelines. So, we've got the framework. Now let's see where the rubber meets the road. Section 4 is all about tackling critical illnesses. We're going to take a look at the key real-world clinical challenges this book gets you ready for.
And wow, the book really covers the whole spectrum of what you'll see on an acute care floor. We're talking about everything from major respiratory issues, like interpreting ABGs for a patient who can't breathe, to cardiac events, where you need to analyze an ECG on the spot. It covers systemic crises like spotting shock and sepsis early, which we all know is absolutely crucial, and even complex neurological states like delirium or unconsciousness. These aren't just topics in a book. These are the core life-saving skills you're going to rely on day in and day out.
Of course, medicine never stands still, right? So that brings us to Section 5, new knowledge, new tools. Let's dig into what's actually new and updated in this second edition to keep you right on the cutting edge. So what's new in this edition? Well, for starters, all the original chapters have been completely revised with the latest evidence. Plus, they've added a bunch of new patient scenarios to really help you apply the knowledge.
But the big news is the brand new chapters. They've added one on acute kidney injury, or AKI, and another one on endocrine disorders, like dealing with hyper and hypoglycemia. Super important stuff. This book isn't meant for you to just passively read it. It's designed to be a really active learning tool. You've got things like quick reference guides for when you need an answer, like right now. There are clinical activities at the end of chapters so you can test yourself and get feedback. And I love this. There are prompts that make you stop and reflect on your own experiences. It's all about closing that gap between what you read in a book and what you actually do at the bedside. And this all leads us to our final and maybe most important section, building clinical confidence. Because let's be real, you can have all the book smarts in the world, but if you don't have the confidence to put it into action at the bedside, what's the point? Because at the end of the day, this is the ultimate goal, isn't it? Positive patient outcomes. This whole guide is designed to show you exactly how you can be the person who makes that positive difference. It's about empowering you to be that calm, confident presence in the middle of a storm and seeing the real, tangible results of your skills, better patient safety, less suffering, and hopefully a better outcome. And the book doesn't just leave you hanging at the end. It actually finishes with a practical action plan to help you take the next steps in your career. It's about mapping out your future, whether that's specializing in acute care or just bringing these incredible skills into whatever area of nursing you're in. It's truly a bridge from just learning the material to becoming a leader in your practice. So, we end up right back where we started, but with a totally new way of looking at it. The question is no longer just, are you ready? With a guide like this in your hands, the real question becomes, how will you influence your next patient's outcome? And that, right there, is both the challenge and the incredible opportunity.